Real high.
Okay.
Heart rate and all over the place.
Okay. Tell me about your blood pressure. My name is Salima Qamruddin. I'm the director of the Women's Cardiovascular Clinic here at Ochsner. I see patients in the general consultative cardiology. I also do this special clinic that it's a niche program that we started 2 years ago, which is the Women's Cardiovascular Clinic, with the specific aim of addressing issues of heart disease in pregnancy, women that are breast cancer survivors that have multiple risk factors that need to be screened for preventive cardiology. There's a new data that's published in Circulation that shows 5 to 7 years if you have preeclampsia. This Women's Cardiovascular Clinic is really a collaboration between Dr. Lepere, who is an obstetrician and gynecologist, and I'm a cardiologist. Women in their 30s and 40s generally are seen by OB because they're delivering a baby. And so if they have risk factors, they may choose not to see a primary care doctor, and then they become mothers and become really busy taking care of their little babies and then toddlers. And then if they have risk factors in those 10 years and they do not seek care, most of them will eventually develop heart disease, especially if they have several risk factors. That if you don't take it, let's say you just take it in the morning, you're going to have less palpitations, but by the time we've traditionally thought that heart disease is a man's disease, that myth has been broken. All the data that has come out of American Heart Association over the last 2 decades have shown that, in fact, if you're a 65-year-old woman, the chance that you'll die from heart attack is 6 times more than breast cancer. When you look at those statistics, you realize that there is a huge gap in awareness. And so what ends up happening is that we are underdiagnosing heart disease in women. And that is a huge gender gap here that needs to be recognized and that needs to be filled. And so we need and we hope that more people will come to us, whether, obviously we can see them in the clinic, but we also can use educational resources to kind of guide them as to how we can bring more wellness in their lives. I'll see you next year, okay?
All right.
Okay, bye.